the effective reproduction number, and wastewater surveillance trends. However, daily hospital and ICU numbers are still rising steeply, and many hospitals across Canada are under intense strain. Nationally, the average daily case count has decreased by 28% compared to the previous week. Although there is a degree of underestimation due to current testing policies, the 7-day average of close to 27,000 cases reported daily as of January 19th shows continuing high rates of infection. As well, with over 22% of lab tests positive for the COVID-19 virus, disease activity remains widespread across the country. Modeling also showed us that the high volume of Omicron cases was expected to result in an unprecedented number of new daily hospital admissions exceeding historical maximums. Over the past week, an average of over 10,000 people with COVID-19 were being treated in our hospitals each day, surpassing peak daily numbers for all previous waves of the pandemic. This includes over 1,100 people in intensive care units, which is higher than all but the third wave peak. During the same period, there were on average 131 deaths reported each day. Evidence continues to show that being vaccinated with 2 or more doses of COVID-19 vaccines lowers the risk of hospital admission. As well, having a booster dose of either Pfizer-BioNTech or Moderna mRNA COVID-19 vaccine helps improve protection that may have decreased since the second dose and results in a better protection against severe illness from Omicron in particular. With over 6.5 million eligible Canadians needing a first or second dose of the primary series and many others who are eligible for a booster dose, there are still more opportunities to enhance our protection individually and collectively with COVID-19 vaccines. Among adolescent and adult age groups, vaccine coverage with 2 or more doses range from 83% to 96%, with room for improvement, particularly on booster dose coverage for adults, which ranges from 21 to 75%. For children aged 5 to 11 years, who more recently became eligible for COVID-19 vaccination, the key opportunity in getting more children on a path to vaccine protection by starting their primary series and raising vaccine coverage up from the present 51% with at least 1 dose. One of the ways we work to build confidence among this age group is through the Immunization Partnership Fund, or IPF. The IPF supports trusted organizations across Canada to share credible, timely COVID-19 vaccination information with their communities. These organizations can help reach underserved and under-vaccinated populations with tailored outreach and interventions to fill information gaps and reduce vaccination barriers. Next Thursday, a number of organizations, including IPF-funded recipients, Children's Healthcare Canada, and Signs Up First, as well as experts from across disciplines, will be coming together to promote vaccine confidence and highlight the importance of building up protection among children during National Kids and Vaccines Day. I encourage parents and guardians, together with their children, to take the opportunity to engage with experts and advocates that respect and support the need for informed and confident decision-making. Though we still have some difficult weeks ahead and potential for more bumps along the way, our many months of efforts have given us better protection with vaccines and brought us several effective treatments that we remain hopeful will change the face of the pandemic to reduce severity going forward. We can all help to ease the path to better days ahead by getting our COVID-19 vaccines up to date and continuing to reduce infection rates by layering personal protections such as masking and limiting in-person contacts as much as possible. So thank you. Merci, Megwitch.
Bonjour à toutes et à tous. La mise à jour sur la modélisation de la semaine dernière a révélé à quel point la hausse marquée des infections attribuables au variant Omicron risquait d'atteindre un sommet au janvier, puis de se résorber en février. Au cours de la semaine qui a suivi cette mise à jour, les premières indications montrent que les infections pourraient effectivement avoir atteint un sommet à l'échelle nationale, notamment par le nombre de cas quotidiens, le taux de positivité des tests, la valeur RT ou taux de reproduction effectif et les tendances relatives à la surveillance des eaux usées. Cependant, le nombre quotidien d'hospitalisations et de personnes aux soins intensifs continue de monter en flèche et de nombreux hôpitaux au Canada sont soumis à une forte pression. Au pays, le nombre moyen de cas par jour a diminué de 28 par rapport à la semaine précédente, bien qu'il y ait un certain degré de sous-estimation en raison des politiques de dépistage actuelles. La moyenne sur 7 jours, soit près de 27 000 cas signalés quotidiennement à partir du 19 janvier, montre des taux d'infection constamment très élevés. De même, avec plus de 22 des tests de laboratoire qui affichent un résultat positif au virus de la COVID-19, l'activité de la maladie demeure largement répandue d'un bout à l'autre du pays. La modélisation nous a également révélé que le nombre élevé de cas du variant Omicron devrait se traduire par un nombre sans précédent de nouvelles hospitalisations quotidiennes dépassant ainsi les maximums historiques. Au cours de la dernière semaine, en moyenne, plus de 10 000 personnes atteintes de la COVID-19 ont été traitées chaque jour dans nos hôpitaux, ce qui dépasse les chiffres quotidiens maximum de toutes les vagues précédentes de la pandémie. Ce chiffre comprend plus de 1 100 personnes dans les unités de soins intensifs, ce qui est supérieur à tous les sommets atteints, sauf celui de la troisième vague. Au cours de la même période, le nombre moyen de décès signalés chaque jour se chiffrait à 131. Les données probantes continuent de montrer que le fait de recevoir au moins 2 doses de vaccin contre le COVID-19 réduit le risque d'hospitalisation. En outre, le fait de recevoir une dose de rappel, qu'il s'agisse de vaccin ARNM contre la COVID-19 de Pfizer-BioNTech ou de celui de Moderna, contribue à améliorer la protection qui peut avoir diminué depuis la deuxième dose et à offrir une meilleure protection contre les formes graves de la maladie attribuables à Omicron en particulier. Comme plus de 6,5 millions de Canadiens admissibles ont encore besoin d'une première ou d'une deuxième dose de vaccin pour compléter leur série initiale et que beaucoup d'autres sont admissibles à une dose de rappel, il reste encore des occasions d'améliorer notre protection individuellement et collectivement grâce au vaccin contre la COVID-19. Dans les groupes d'âge des adultes et des adolescents, la couverture vaccinale avec au moins 2 doses varie de 83 à 96 mais des améliorations sont possibles, notamment en ce qui concerne la couverture des doses de rappel pour les adultes, qui varie de 21 à 75 Dans le cas des enfants âgés de 5 à 11 ans, ils sont devenus plus récemment admissibles à la vaccination contre le COVID-19. La principale opportunité consiste à guider un plus grand nombre d'entre eux vers la voie de la protection vaccinale en amorçant leur série primaire et en augmentant la couverture vaccinale, qui est actuellement de 51 avec au moins une dose. Le Fonds de partenariat d'immunisation, ou FPI, est l'un des moyens que nous utilisons pour instaurer la confiance auprès de ce groupe d'âge. Le FPI aide les organismes de confiance de partout au Canada à transmettre à leur communauté des renseignements crédibles en temps opportun sur la vaccination contre la COVID-19. Ces organismes peuvent contribuer à joindre les populations mal desservies et peuvent vacciner grâce à des mesures de sensibilisation et à des interventions adaptées visant à combler les lacunes en matière d'information et à réduire les obstacles à la vaccination. Jeudi prochain, un certain nombre d'organismes, notamment les bénéficiaires d'un financement du FPI, Santé des enfants Canada et la séance d'abord, ainsi que des spécialistes de diverses disciplines, se réuniront pour promouvoir la confiance à l'égard des vaccins et souligner l'importance de renforcer la protection des enfants à l'occasion de la Journée nationale de la vaccination pour les enfants. J'encourage
I
les parents
encourage
et
parents
les
and
tuteurs
guardians, together
ainsi que
with their
leurs enfants
children,
à
to take
profiter
the
de l'occasion
opportunity to
pour
engage with
discuter avec des
experts
experts et
and
des
advocates
défenseurs
that respect
qui
and
respectent et
support the
soutiennent la
need for
nécessité
informed
d'une
and
prise de
confident
décision éclairée
decision-making.
et ont toute confiance. Même si nous avons encore des
Though
semaines
we still have
difficiles
some difficult
devant nous
weeks
et que nous
ahead and potential
risquons
for more
de
bumps along the
rencontrer
way,
d'autres
our
obstacles,
many months
les
of
efforts que
efforts
nous
have given us
déployons
better
depuis de
protection with
nombreux mois
vaccines
nous ont
and brought
permis
us
d'obtenir
several
une meilleure
effective
protection
treatments.
grâce aux vaccins et de mettre au point plusieurs traitements efficaces qui, nous
We
l'espérons,
hope they will
changeront le
change the
visage de
face
la
of the
pandémie
pandemic to
et en
reduce
réduiront la
severity going
gravité à
forward.
l'avenir. Nous pouvons
We
tous
can all help to
contribuer
pave
à
the way
tracer
to
la
better
voie
days
vers des
ahead
jours
by getting our
meilleurs en
COVID-19
nous
vaccines
assurant
up
que
to
nos
date
vaccins contre
and
le
continuing
COVID-19
to
sont à
reduce
jour et en
infection
continuant de
by
réduire les taux
layering personal
d'infection
protection
en
measures
combinant
such
les
as
mesures de
masking
protection
and
personnelle
limiting
comme porter un
in-person
masque
contacts
et
as
limiter les
much as
contacts en
possible.
personne le plus possible. Merci.
Thank you.
Thank you.
Merci,
Miigwech.
miigwech.
Okay, thank you so much, doctors. We have quite a bit of time for questions today, but given that we had very few people able to get through on the phone lines on Monday, I'll ask for questions to be brief and answers as well to be brief if possible. We'll start in the room with Mackenzie Gray and then go to the phone lines.
Hi, Dr. Tam. My first question is about a study that came out with the CDC today. There's some really strong numbers about boosters. 90% effective against hospitalizations, 82% effective against preventing people ending up in the hospital. And people with a booster are 66% less effective to end up getting an infection against Omicron versus people who only have 2 shots. The top CDC advisors already come out today after this and said, look, we need to change the definition of what it means to be fully vaccinated to be 3 shots. So now is it only a matter of time in Canada that 3 shots is going to be the standard for fully vaccinated versus 2 shots?
And I think it's very important to get the booster. So that is the first message, as I've said in my opening remarks. So everyone should try and get the boosters as soon as they're eligible. And that's really important. I think it depends on the objective of what the definitions are used for. And a lot of it in the jurisdiction of the provinces and territories. But we will be discussing this going forwards, as I said, once there's been more people who are having had the opportunity to access the booster doses.
On kids, you mentioned...
Dr. New, maybe I could just add to that. I think there's sometimes maybe a bit of confusion, I think, in the general public as to, what is a booster dose. And so I think what Dr. Tam and I are sometimes use the phraseology is better sort of keeping up to date with your vaccinations, because let's say for the large part of the population, maybe getting 2 doses, maybe 8 weeks apart and so might constitute what we call a primary series. You get a good level of immunity from that. But for others who may not be able to mount a good immune response, maybe their primary series might actually consist of 3 doses as opposed to the 2 doses. So and then after that, if you have a good response from your primary series, then a booster dose is the one that you might be giving 6 months or later after that sort of completion of your primary series to then bring your immunity up after it wanes over time. So you're right. There's still lots to look at, and Nancy will be looking at sort of the overall question of booster doses and the timing. But I just want to maybe clarify that issue in terms of what constitutes the number of doses in a primary series versus boosters. Thanks.
On kids, Dr. Tam, you mentioned in your remarks that only 51% of eligible kids are fully vaccinated at this point in time, which means that there are a lot of parents out there who are fully vaccinated themselves but have decided not to make sure that their kids get vaccinated. Why do you think there's such a disconnect, potentially with hundreds of thousands or millions of fully vaccinated parents not letting their kids or not wanting their kids to end up getting vaccinated?
Because I think we need to look at the reasons behind this more closely. But what I do know is before the program started, that there was a very high proportion of early adopters, around 50%. So maybe that's what we're seeing. But there were quite a high proportion, 25 to 30%, I believe. I can't quite recall the exact public opinion research numbers, but around that sort of ballpark of parents who are just waiting and seeing, because of course children are very important in their lives, and the primary piece of information they wanted to know is, are the vaccines safe? And so I think we can now safely say that millions of doses of the Pfizer lower dose vaccination for children have been deployed. There's no safety signals of concern. And so I think it's this group of parents that we're hoping to reach in so many different ways, as I've said, with the Immunization Partnership Fund, to make sure parents and kids get their questions answered. So I think this is the next phase to try and get that next group of kids vaccinated. And some of our experts will be providing their time next week to answer those questions. So both access to information and easy access to the vaccine, I think is very key for the next phase.
Okay, Patrick, we'll go to you on the phone lines.
Thank you, merci. You may press star 1 at this time if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Boris Proulx, Le Devoir.
Boris Proulx from Le Devoir. You have the floor.
Oui, bonjour. Ma question porte sur les tests à la frontière
My
et
question is on
aux
border
aéroports.
testing and
Êtes-vous
in
préoccupé
airports.
par le taux de
Are you
positivité
concerned
qu'on
by
voit
the
pour ces tests?
positivity
Et
rates
est-ce
that
que,
we're
selon vous,
seeing
le
for these
Canada devrait
tests?
continuer
Do you
ou
think
cesser de
Canada
tester
should continue
systématiquement
or
les
stop
voyageurs
systematically
que les
testing travelers, specifically from the United States?
Merci pour la question. C'est
Answer.
Dr. New. Peut-être moi
Thank
je peux
you for the
commencer. Oui,
question.
oui,
This is Dr. New.
c'est
Maybe
toujours
I'll answer
important à
first.
suivre
Of course,
étroitement
it's always
c'est quoi les
important
données on
to
reçoit
follow the
à
data
nos
that we
frontières
get at the
concernant
borders.
comme des résultats de
We
positivité
need to
parmi les
understand the
voyageurs. Oui,
positivity
on
rates
voit
among
que les taux
travelers.
de
We've
positivité
seen that
ça a
positivity rates
augmenté
have
depuis
increased
plusieurs semaines. Donc, je
over
pense
the
que
last few weeks.
ça démontre l'importance des mesures qu'on a
This
prises à
demonstrates
nos
the
frontières pour
importance of the
protéger
measures that we've
la santé et sécurité des
implemented at the
Canadiens.
borders to protect the
Et
health and
c'est
safety of
très important aussi
Canadians.
pour la
It's
surveillance
also
parce que c'est pas
important
seulement une
for
question de
monitoring.
diagnostiquer
It's not
les
just
voyageurs
about
individuellement, mais aussi
diagnosing
pour
individual
peut-être
travelers.
détecter peut-être
We want
un autre
to
variant, un nouveau
be able
variant.
to
Donc,
detect any
ça,
new
ça fait
variants, for
partie de
example.
notre programme de dépistage à
This
la
is part
frontière.
of
Mais
our border
c'est sûr,
screening
on
program.
continue à évaluer nos
Of course,
efforts à la
we are
frontière
continuing to
et au
assess
fur
our
et à
efforts
mesure
at the
avec
border
la situation,
as the
si ça change au
situation
Canada, mais
evolves.
aussi partout dans
And
le
this
monde,
is about the
on va
evolution of the
continuer à
situation in
évaluer et
Canada
peut-être
and
adapter
worldwide.
comme c'est nécessaire.
We will continue to adapt as necessary.
Merci. Et ensuite, il y a plusieurs juridictions provinciales qui
Thank
commencent
you.
à
There are
annoncer des
also
assouplissements pour le
some
mois de
provinces that
février.
are starting
J'aimerais
to
savoir si, selon vous, c'est
loosen
approprié et si
restrictions
on a
starting in
assez de
February.
tests
Do you
rapides
think
pour
this is appropriate,
cette
and do we
prochaine
have
étape.
sufficient rapid tests for this next stage?
OK, c'est Dr. New encore. Merci pour la question.
Answer. This is still Dr. New. Thank you for the question.
Écoutez, le Canada est un grand pays
You know,
et
Canada is a
l'expérience,
large
qu'est-ce qui se
country.
passe actuellement sur le terrain dans
The
chaque province et
experience
territoire
of each province and
aussi
territory
différent parmi
is
toutes les
different.
provinces et territoires. On a vu même avec Omicron que
Even with
les
Omicron,
deux grandes provinces,
we saw
Ontario et le
that the
Québec,
two
peut-être
largest
commencer avec
provinces,
leur vague
Ontario and
d'Omicron un
Quebec,
peu plus tôt comparé aux autres provinces.
had
Donc,
their Omicron
je pense que
wave
c'est plus
first
pour les
compared to the other
autorités
provinces. So it's up
dans les
to
provinces et
provincial
territoires à vraiment
authorities and
regarder
territorial
étroitement
authorities
qu'est-ce
to
qui se passe avec l'épidémiologie, puis aussi
understand
avec
their
leurs
local
experts de
epidemiology.
modélisation avec
They
les
need to
données
consult
probantes
with
qu'ils ont à leur
experts on
disposition
modeling
de
and
leur
use
propre
data
juridiction
in
pour
their
prendre des
own
décisions pour
jurisdictions
peut-être
in order
assouplir
to
les mesures
make
de
these
santé publique
decisions
au fur et à
and
mesure
decide
selon
whether or not to
les
loosen
données probantes.
restrictions.
Et pour moi, c'est difficile pas
For me,
prononcer pour
it's
chaque province et
difficult to
territoire, mais
speak for
je
each
suis sûr
province
que
and
nos
territory.
homologues des provinces et territoires
Of course, my counterparts
sont très attentifs
are very attentive
aux situations
to
et
their
on
own
continue à
situations,
regarder les données probantes et
and
donner leurs
they are
meilleures
keeping their eye
recommandations
on the
aux
data,
décideurs.
and we leave it up to decision makers
Thank you,
to use
merci.
this
The next question
information.
is from David Aiken from Global News. Please go ahead.
Well, thank you very much, doctors. Appreciate your time. Maybe Dr. Tam, this is for you. It sort of goes to that fund announcement today about disinformation. We have some new polling that suggests Canadians do have some concerns about getting ever more COVID-19 shots, boosters. And I know, Dr. New, you were saying, it's important to keep up to date on vaccines, but a lot of Canadians, when asked, would you get a fourth dose? They sort of roll their eyes and go, they seem to be resistant. So I'm wondering if you have some thoughts about how our vaccine strategy might change, the communications. Is it likely we'll need annual boosters, strain-specific vaccines? vaccines for the most vulnerable only. I wonder if you could speak about the vaccine strategy in a climate where people are wondering, oh, I got to get a fourth dose or more doses.
Yes, I think we have to examine, of course, the data in numerous streams, including the level of protection, the vaccine effectiveness studies. I think we were very fortunate to get some very effective vaccines quite early on in the pandemic, and we are essentially learning about some of the spacing in the doses and the number of doses required. But at the same time as studying that, the virus itself is also undergoing evolution. So that's another stream of data that we need to watch out for. But what we will say is that I think the global opinion at this point is that the Omicron virus is going to be with us for some time. So we do need to take a longer term approach in thinking about our vaccine strategy. So I think that's the next step, and we need to do that with the National Advisory Committee on Immunization. Of course, they've been asked to examine the need, for example, of a fourth dose, but they are taking very thoughtful approaches to examine that question. But I think everybody would appreciate that for influenza, for example, that's now an annual vaccine. People have had that. I've had that for decades, every year. So it's not a question of whether many different doses in our lifetimes is a concern. I think we have very good examples of where vaccines can be given time and again over the course of our lives. But it is, I think, quite an important moment, and in the next year, leading up to the next respiratory virus season, to try and work this out as much as possible. So there are a number of unknowns, as you've pointed out, in terms of, well, what strain should we be using, and who needs to get an additional dose. I do think that the primary objectives have to be clarified. And right now, I think the key is to prevent serious outcomes. And we need to look at that going forward as well.
And just a data follow-up, really. This may be available at somebody's dashboard. I just haven't seen it. Dr. Chan, you talked about the number of people in hospitals, the number of people in ICUs. With COVID, do we have a rough idea of how many of those in hospitals or in ICUs are dealing with Omicron or Delta or even the Alpha variant? Do we know or have some data, some perspective on which particular variant is pushing up these hospital counts?
Yes, not everyone in the hospital will have genetic sequences done. Some will get targeted genetic screening to look at what we call an S gene dropout. So you will not get that precisely from every hospitalized patient. But what we do know is from our surveillance system that is almost all Omicron. Ever since around December the 20th, as Omicron began to really take over the majority of the genetic landscape, as it were, that's what we expect to be in the hospitals right now. We're not seeing much in the way of Delta or any other variants, but we're monitoring that very closely. And by the way, including the sublineages of Omicron, which is getting a bit of news today, I think.
Thank you. Merci. La prochaine question de Louis Blouin, Radio-Canada.
Louis Blouin, Radio-Canada.
Bonjour à vous. J'aimerais vous parler du dépistage dans les aéroports, le dépistage systématique.
Systematic screening is happening right now for all passengers. Many experts are saying that it's no longer necessary to screen all travelers arriving in Canada, especially because the processing delays are very long. Are we going to go back to random testing in airports?
Merci pour la question. C'est Dr.
Thank you for the question. This is Dr. New.
On a déjà répondu à cette question, mais je peux répéter que oui, c'est toujours important avec ce qu'on fait à nos frontières de toujours évaluer avec les données probantes les résultats et peut-être ajuster comme c'est nécessaire. Donc, on continue à évaluer avec les résultats qu'est-ce qu'on voit actuellement sur le terrain à nos frontières et au fur et à mesure, on va analyser et donner des recommandations peut-être pour ajustement comme c'est nécessaire.
give recommendations for adjustments
Donc,
as necessary.
est-ce qu'il y a des ajustements qui pourraient s'en
Question.
venir au cours peut-être des prochains
Are
jours?
any
Et ma
adjustments
deuxième question,
coming in the coming
à l'heure
days?
actuelle,
And
il y a
second
une autre
question,
règle qui est en
there's
vigueur qui
another
touche beaucoup de
rule
familles canadiennes, c'est que les
that
plus
affects
jeunes
many
enfants là, qui ne
Canadian
peuvent
families.
pas être vaccinés,
Younger
qui
children
reviennent au
cannot be
Canada, ne
vaccinated,
peuvent pas aller à la garderie pendant
and when they
14
come
jours
back
après
to
leur
Canada, they
retour
can't
au
send their
Canada.
children
Il y
to
a des
daycare for
provinces qui ont
14
revu
days
les
after
règles
their
visant
return.
les jeunes
Some
enfants.
provinces have
Alors, le
reviewed
fédéral semble un peu être
the
en
rules,
contradiction avec ce qui se fait dans
but the
certaines
federal
provinces
government
pour les
guidelines
jeunes
seem
enfants
to be
comme ça. Madame
contradicting
Desmaires,
what
entre
is
autres, a dit
happening.
que maintenant, en
Mrs.
2022,
Desmaires
cette
said that
restriction-là est un peu
this
incohérente avec
restriction
d'autres règles
is no
provinciales. Est-ce que vous
longer
allez lever cette
sensical. Are
restriction-là?
you going to lift this restriction?
Oui, c'est une des
Answer.
mises, c'est très comme détaillé, mais oui,
That
on
was
est
very
d'accord que oui,
specific,
c'est
but
toujours
yes,
important de
we do
peut-être
agree
réviser
that it's
qu'est-ce
important
qu'on
to
fait à nos
reassess
frontières avec
our border measures.
l'introduction de Omicron et
With the
qu'est-ce qui se
arrival
passe
of
actuellement dans le
Omicron
pays. Oui,
and what's
c'est
happening
sûr,
in
il faut
Canada,
toujours regarder, évaluer qu'est-ce qu'on fait
we have
avec
to
la
assess
politique à
our
nos frontières. Oui,
policies at the
on est
border.
toujours prêt à adapter et peut-être ajuster
We have
les
to be
mesures
ready to
comme
adapt
c'est
and adjust
approprié.
measures
Merci.
as appropriate. Thank you.
Thank you. Merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead.
Hi, good morning. I'm curious if you could talk a little bit about the death rates that we're seeing and the death numbers we're seeing from COVID this particular month. The numbers seem to have climbed substantially, including among children. And I'm just wondering if that's severity related or if this is still because there's just so many people getting Omicron.
Mm-hmm.
Yes, I think this is Teresa Tam. I'll answer your question first. I think it is the sheer volume of cases. And at the beginning of the Omicron wave, it was very much concentrated on younger adults. And then it began to spread into the other age groups, as one might expect. So I think the vast majority of the severe outcomes, though, are still in the elderly population, people who are over the age of 60, the key population groups ending up with the more severe outcomes in the hospitals. And the mortality is the highest in the very oldest age groups. So that is still the trend that we're seeing. There may be some reports of severe outcomes in children, but they're still very rare. In terms of rates, they're still very low.
Thank you. And earlier this week, you were at the Health Committee and you were asked a few times about the quarantine period, the isolations that have been lowered in most provinces now. I'm wondering if you could say what advice the Public Health Agency is giving provinces about easing these isolation dates from 10 to 7 to 5 days, et cetera, and what role testing should play in the decision about whether or not someone should come out of isolation.
Yes, at the Special Advisory Committee, we share information and the synthesis of the evidence that we have gathered on an ongoing basis with the provinces and territories. In terms of the isolation period, for example, there was very little information, as you can imagine, coming out at the beginning of the Omicron wave. And then there were a few studies that were being published which suggested that the period during which you can shed the virus and can potentially communicate is not that different from other variants. Having said that, there's a massive number of cases. And this has a great impact on our society, on our critical services, on the healthcare service itself. So provinces, recognizing the data that we have, made the decisions from a policy perspective and a business continuity perspective, for example, to adjust some of the policies. But all of them have said that regardless whether it's 5 days or 7 days, for the rest of that period, you have to wear a well-fitted, high-quality mask and take on those other layers of protection because there's always a possibility that transmission could occur. So those are ongoing discussions for sure. And the same with the quarantine period in terms of, well, exactly what is the incubation period, what is the latent period. So we have those technical discussions, but in the end, provinces have the tough job of making it work on the ground. And I think that's the situation that we're in now.
Thank you, merci.
discussions for sure. And the same with the quarantine period in terms of, well, exactly.
I'm sorry, Madame Guillemette, votre ligne est ouverte.
Madame Guillemette,
on
your
vous entend,
line
donc
is
on
on.
entend le
We
web.
can hear the
Work on the
webcast
ground.
of the press
And
conference.
Baissez le volume.
Can you turn the
that we're
volume
in now.
down?
If whoever is playing audio of Dr. Tam
Thank
on
you,
the
merci.
line could stop.
Discussions for sure. And the same with the quarantine period.
Madame Guillemette. I'm sorry, Madame Guillemette, votre ligne est ouverte.
You have the floor.
On vous entend, donc I'll have to go with the
your
next
line
question.
is on and we can hear
the
you.
next question is from David Thurton from CBC News. Please go ahead.
Hi, yes. This question is for Dr. Tam.
Was she the same person?
The Institute of Health Metrics and Evaluation out of the University of Washington has said today that the pandemic is winding down. The pandemic is winding down and will be over by April, with COVID essentially becoming a seasonal flu. So, Dr. Tam, your thoughts on this, please.
I think that there are many experts in the world trying to work out this question, and I don't think the what you just said was, it's necessarily the scenario, but it is a possible scenario. So I think we need to prepare for different potential futures. I think one of the scenario is that, of course, after this massive Omicron wave, and we have boosters and more kids are getting vaccinated, the population should have a reasonably good immunity, at least for this period of time, and at least against the Omicron variant. So we need to see how that immunity continues. We know that waning immunity does occur, and we need to prepare for any potential unusual variants that might come along. At the same time, though, we do need to lay out a strategy and a plan towards moving back to something that is nearer normality. And I think one thing that many experts do agree on is the Omicron, well, not the Omicron, the COVID-19 is going to stay, and the coronavirus will continue to be in the human population. So how do we manage that going forwards? I think it's quite reasonable to think that we need to plan for the next respiratory virus season as well.
Thank you for that. The same institute also suggests that the Omicron wave will essentially be over in a few weeks, and that it will be time to lift mask mandates, vaccine passports, and other restrictions. So yeah, your thoughts on that as well, Dr. Tam.
I think we gave some idea at the national level as to where this wave is going. So I think in the January timeframe, the peak may occur, but the hospitalizations and the ICU admissions may continue to increase for some time. So that's in February. And I really hope that by the end of that next month, we'll be in a better position. And during that time, people are very busy, of course, responding to the Omicron wave, but we need to plan ahead for the next phase. And that, we have to focus on our goals, which I think has been articulated as reducing severe illness and severe morbidity and mortality, as well as reducing societal disruption. So that balance has to be worked out. There is no doubt that nobody wants to have all these restrictive measures anymore, and Omicron may or may not have put us one step towards that newer reality. So I think, as I said, we need to plan for the different scenarios and just be ready for a time of emergence of new variants. But we got to move on and see how we can make our societal functions closer to what they were before the pandemic.
It's Dr. New. Maybe I can just comment further. You're mentioning two tools and sort of the word mandates attached to that. I think the way I look at it, you were talking about vaccines and masks. I think, from a public health perspective, we want people to be sort of informed and make that a voluntary choice, to get a vaccine, because we know that vaccines are a very important tool, safe and effective in terms of how we manage not just the Omicron variant wave right now, but just for COVID-19 into the future. So I think that's something positive we need to keep building on. And as far as the use of masks, as you put it, I think it's I think in many ways an empowering sort of personal protective measure that people should be encouraged. It doesn't have to be because there's a mandate. It's because people see the value in and of itself to protect themselves and protect others to wear a mask. And maybe even in the future, it's not because of COVID-19, but also maybe for other respiratory viruses. And maybe they'll get baked in, as they say, in terms of a sort of a good personal protective habit that will always, maintain, through, let's say, winter and respiratory virus season. So that's how I would look at it in terms of looking at the sort of the negative way in terms of, we can lift mandates on masks, etc. Thank you.
Thank you, merci. La prochaine question de Raphaël Pirot de Agence QMI. La parole est à vous.
Raphaël Pirot, Agency QMI.
Oui, bonjour à vous. Merci de prendre nos questions.
Hello, thank you for
Je veux
taking our
savoir,
questions.
le Canada a un des taux de lits dans les hôpitaux les plus bas.
Canada has among the lowest rates of beds in hospitals of all OECD countries.
Notre gestion de la pandémie en ce moment.
The few beds that we have affect our management of the pandemic?
Answer. Moi, je suis une spécialiste de la santé publique, Dr. Tam, moi et les autres spécialistes.
Dr. Tam and I
on analyse les données probantes et puis on donne nos meilleures recommandations aux décideurs pour gérer la pandémie. La question que vous posez concernant comme vraiment l'infrastructure, le système de soins de santé, on sait que oui, peut-être dans quelques provinces, il y a la capacité, c'est différent peut-être d'une province à l'autre et c'est pas vraiment pour moi pour dire qu'est-ce qui se passe actuellement avec la gestion de la pandémie liée au, comme vous avez dit, le nombre de lits dans les hôpitaux. Je peux voir, on voit actuellement qu'est-ce qui se passe au Québec avec leur capacité, le système de soins de santé et c'est sûr qu'avec la pression sur leur système de soins de santé avec les hôpitaux que le gouvernement de Québec continue avec les mesures de santé publique très sévères, on peut dire restrictives pour protéger leur système de soins de santé. Mais c'est une bonne question, peut-être plus tard à examiner c'est quoi peut-être le bon équilibre pour la capacité du système de soins de santé pour être, comme dit, prêt pour une prochaine pandémie. Mais actuellement, on fait ce qui est nécessaire pour protéger les systèmes de soins de santé. Je suis sûr dans chaque province et territoire.
Merci.
D'accord, merci. Et il y a aussi le gouvernement du Canada a commandé
the Canadian government has ordered mobile healthcare units. Maybe the answer will be the same, but I was wondering if on your end you recommended that these mobile units be deployed to the provinces and territories.
Je crois que c'était à la fin
they were
de 2020, donc il y en a
at the end of 2020, and they're being underutilized.
Auquel vous est-ce que vous êtes questionné sur le fait qu'on ne s'en sert pas en ce moment?
The fact that these units are not being used right now.
Oui, merci pour la question. Moi, je n'ai pas les détails, mais c'est sûr, oui, on a des unités mobiles, comme vous avez constaté, et on est toujours prêt, comme le gouvernement fédéral, à répondre aux demandes. S'il y a une demande, parce que peut-être une province à déborder leur capacité pour gérer la pandémie dans l'hôpital. Et donc, on est toujours prêt. Peut-être que ça fait partie d'une gamme des options. On peut offrir aux provinces et territoires, mais je ne suis pas au courant avec les détails. C'est quoi l'État avec comme les demandes individuelles des provinces et territoires, mais je suis sûr que ça fait partie des options qu'on peut offrir aux provinces et territoires.
Thank you. Merci. The next question is from Raisa Patel from the Toronto Star. Please go ahead.
Thanks for taking our questions. Dr. Tam, back in December, you published an annual report in which you said Canada was not prepared to handle a crisis of the magnitude of COVID-19. At the time, you said it was too early to know how Omicron would impact our pandemic response. But now that we have a better understanding of Omicron, do you think this country was not prepared to handle that variant as well?
I think this pandemic has affected every country in the world, and Canada is not any different. But to sustain this response for this long is also a massive challenge. And I think, based on the last set of questions as well, that it's really difficult to maintain the health system as a whole functioning for this long with this much pressure. So I think a lot of our pandemic response to the Omicron wave, or this current wave that we're in, much of it is to protect that health system, particularly the healthcare system, from being, really under pressure. So I think Canadians understand that that's partly why, on the ground, some of the measures had to be enacted, because you can't cope with this level of ICU admissions and hospitalizations without some major impacts. And what is different about this wave compared to others is the absenteeism, and because of the infection rates and the high transmissibility of the Omicron wave. So it is quite a challenging wave. Which is different from other waves is the continuity of the health human resource. And so I think those challenges continue. And but of course, we're not alone in that. And but again, only together and by supporting our health systems can we get through this.
And as a follow-up, Ben, do you think that the federal government should have done more since the onset of the pandemic to help provinces and territories expand testing capacity and healthcare capacity to prepare for surges like the one we're seeing now?
Well, I think, everything is being done to try and support those things. As I understand it, you can try and buy up as many tests as possible, etc. But there's deployment on the ground that needs to be done, and some of it is some of the testing limitations is not because you don't have enough PCR testing lab infrastructure. It's because some of the people were sick and some of the people who collect samples were sick. So it's a very different scenario to be working with. But I think getting enough vaccines, making sure there's boosters, continuing to supply the testing support as fast as much as we can. Those are some of the fundamentals, and of course, evolving our guidance to make sure Canadians can protect themselves as much as possible. In a pandemic scenario, for example, for influenza, where we did envisage scenarios where everybody has a synchronous wave, more or less, and you're all impacted, and the ability to provide surge and help each other in mutual aid is very difficult to sustain under those circumstances. And so pandemic plans always have to deal with prioritization and those difficult decisions that have to be made. So I think, I believe everyone is doing the best that they can, but I think ahead of next winter, we need to plan ahead and see what we can do to make sure the systems are as sustainable as they can. But I think everybody that I've talked to said is the exhaustion of the health human resource and the sickness.
Moderator, how many more questions do we have on the phone line?
We have at this time 2 questions left.
Okay, great. If we could get both in, that would be fantastic. Thank you.
Certainly. La prochaine question de Pierre Saint-Arnaud, La Presse canadienne.
Pierre Saint-Arnaud, Canadian Press. You have the floor.
Oui, merci.
Thank you.
Ma première question, c'est qu'on a parlé de la modélisation qui a été faite au niveau fédéral, qui nous indique et qui semble avoir été assez juste, là, que les cas devaient commencer à plafonner et à diminuer à partir de janvier. Quelle est votre modélisation au sujet des hospitalisations qui, elles, continuent à monter maintenant? Qu'est-ce qu'on peut prévoir? Qu'est-ce que vous avez prévu dans vos modélisations pour les hospitalisations et les soins intensifs?
And intensive care.
Merci pour la question. C'est Dr. New. Oui, avec la modélisation, on sait toujours que les hospitalisations, c'est un indicateur tardif. Donc, c'est toujours quelques semaines après l'incidence des cas. Donc, si on a peut-être un plateau des cas, on a des indications peut-être qu'on a presque au sommet ou peut-être au sommet, on ne sait pas. C'est toujours, on doit regarder dans les rétroviseurs pour être sûr qu'on a passé le pic déjà sur la pente descendante. Mais on peut voir que peut-être avec les hospitalisations, ça va continuer peut-être une autre quelques semaines après le sommet des cas. Donc, si on est vraiment au sommet ou presque même après le sommet des cas, on peut attendre encore quelques semaines des taux élevés des hospitalisations avant peut-être une diminution. Ça, c'est après les données probantes, on a jusqu'à date, mais ça peut changer toujours. C'est toujours une question de ramasser d'autres données probantes et continuer à travailler avec des experts dans le domaine.
Merci. Ma deuxième question, c'est... Vous faites état de 6 millions de Canadiens qui ne sont pas vaccinés. Il y a une part importante de ces gens-là qui ne veulent pas être vaccinés, qui ne le seront pas. Est-ce qu'on est prêt à gérer la suite des événements avec une proportion aussi importante que ça de personnes qui ne sont pas vaccinées? Qu'est-ce que ça implique au fond pour la planification?
C'est une bonne question, c'est Dr. New.
This is a great question.
Moi, je pense que c'est toujours important parce que c'est sûr avec les personnes peut-être un peu non protégées, non vaccinées, c'est toujours une opportunité pour le virus de continuer à circuler. On va encore avoir la transmission peut-être importante dans quelques populations. Donc, je pense avec notre planification, on continue à encourager l'adhésion pour augmenter la couverture vaccinale. Et je pense que si on veut retourner, d'après moi, à un fonctionnement de notre société, c'est aussi une question d'encourager la vaccination avec tous les moyens disponibles. Je pense qu'on a déjà avec la population qui est bien informée, qui apprécie la science, c'est ceux qui ont déjà reçu leur vaccin. Je pense peut-être pour motiver les autres, c'est aussi peut-être il faut peut-être donner certains privilèges aux personnes vaccinées, peut-être pour rentrer dans les espaces publics, les restaurants, tout ça, c'est un autre moyen, mais je suis sûr que c'est toujours important de continuer avec nos efforts. C'est jamais trop tard. On dit même aujourd'hui que si vous faites partie de la population de 6,5 millions de Canadiens, encore admissibles, on vous encourage, c'est jamais trop tard pour avoir la première dose ou deuxième dose pour compléter la série initiale. Et on va continuer dans ce voie-là, mais à part de ça, c'est aussi une question de garder quoi d'autre on peut faire avec les autres mesures disponibles.
With regards to other available measures.
Thank you, merci. You may still press star 1 if you have a question. Vous pouvez toujours appuyer sur étoile 1 si vous avez une question. The next question is from Christine Barak from CBC National News. Please go ahead.
Thank you both for taking our questions. Mine is on the rapid test front. Based on a research project, Nova Scotia Health is now recommending people swab both their nose and throat to get more accurate rapid test results. Just wanted to get your sense of that approach and the latest data on this. People are to some degree relying on these tests. What should they be keeping in mind?
Yes, thank you for the question. That's a great Canadian study. So we really welcome that. We actually had Dr. Hatchett present to the Chief Medical Officers very recently on his results. So we will be taking that into account. And I've asked our laboratory networks, our laboratory experts to take that into account and see whether we can provide some further guidance. But of course, I think we have been discovering that the Omicron virus may be behaving a bit differently to the previous variants. And so this approach to swabbing might be useful, but different kits have different swabs, and I learned a lot about that sort of recently. Some of them are more flexible, some of them are designed a bit differently. So I think the different kits need to be examined, but I think his study will go, is very welcomed and will go a long way in terms of helping us with our next set of recommendations. That's not to say that, well, what about the next variant? You know, so I think it's really great that these studies are being done, and I look forward to our lab network maybe providing the next set of guidance that Canadians need.
What would be your, that's great, I'm glad that you're briefed on the research project, but what would be, based on what you've seen and I guess the amount of research you have done on your own recently, what's your best advice at this point for using rapid tests?
I think Dr. Hatchett's and his team's results is looking at how you swab, and in this current context, using the kits that he's examined, swabbing the back of your throat and then the nose area is potentially provides you with the highest yield. But if you can only do one site, go along with the manufacturer's instructions and do the nasal swab. So I think that's looks like some very sensible advice, because rapid tests, we got to make the best use of them. So if by some adjustments to the swabbing technique, we can get a high yield, that's always a great thing to do.
Operator, are there any other questions on the phone line? If not, we have one more in the room.
There are no further questions on the phone.
Okay, excellent. I will take this opportunity to ask Dr. Tam a follow-up from CTV's question for my colleagues in Toronto. You said that there is a question of definition regarding boosters and whether that's part of being fully vaccinated. Can you please explain what that question is? Are you questioning whether we need booster as part of the definition for fully vaccinated?
Is that referring to an earlier question? I think.
Yeah, it's referring to what you said to Mackenzie Gray.
Okay, so currently, for a number of administrative purposes and on the ground in the provinces and territories, for going into a certain setting, for example, there is a definition for what fully vaccinated is, which consists of really the primary series. So a 2-dose vaccine, you need 2 doses. 1-dose vaccine, the Janssen vaccine, is that first dose. But we all know that it is very important to get the booster dose, particularly in the time of Omicron. So we began to switch terminologies now to the concept of being up to date. So by being up to date is if you are in certain age groups and you're eligible for the booster, getting the booster or the additional dose is what we mean by up to date. But that has not been built into the definition for administrative purposes of whether you can enter a certain space or going to a certain task, or indeed for international travel. That has not changed. It's still the primary series or the first 2 doses for the most part. But we will be re-examining those kind of policies going forwards. Particularly, now is not the right time because not everybody's had the chance to get that additional dose or getting up to date. Not in Canada and certainly not globally. So we will need to re-examine that posture in the future.
Thank you. And just going to Mia's question on the increasing death rates, regarding Quebec, is Quebec a leading indicator of what we will see in death rates across Canada? Or is there something different in the experience of hospital healthcare system in Quebec that is leading to higher death rates in Quebec than elsewhere?
I think Quebec is certainly one of the provinces that experienced the Omicron surge the earliest, so that could play into it. But there may be other factors as well, whether it's related to the actual impact of the Omicron wave in the Quebec population. But I think there were some questions about differences in methodology and reporting of the deaths. So maybe a number of these factors are playing into the different numbers. But all to say, though, is Omicron can cause serious outcomes. We cannot trivialize this virus. Many people who are, particularly those at high risk, can get very severely sick, and indeed many have died, and we need to do what we can to prevent those.
Okay, that wraps up all our questions for today. Thank you both to Dr. Tam and Dr. New for being so generous with your time. Have a good rest of the day and happy weekend.
You too. Thank you.
Thank you. Bye-bye.